Fantastic. All right. Ladies and gentlemen, my name is Ethan Fogg. I'm the president of the Canandaigua Chamber of Commerce. Welcome to Tuesday at 2. We're here with Mosaic Health, 3 of their staff. We have Amy Arp, Mallory Eberly, and Sam Glarner. The 3 of us today are going to help us. They're going to start off. I think Sam's going to start with helping us understand a little bit about Mosaic Health, their long-time history in our community as Rushville Health Center, and then transition into today's primary topic, really how to be perhaps good citizens in the days of COVID-19 and how to control our negative impact and perhaps even increase our positive impact on the community as we go about our day. So welcome to you all, and the floor is yours. Thank you.
Hi, well, thank you, Ethan. Like Ethan said, we are family nurse practitioners from the Mosaic Health Rushville, formerly the Rushville Community Health Center. And we changed our name last year to reflect that we are actually a much bigger organization. So we also have clinics in Utica as well as Ilion. We also do several dental clinics in Lyons and quite a few other places, as well as doing dental clinics in schools. And we also work with Rochester Regional Health to kind of help them with some of their federally qualified health centers as well. So Mosaic Health was meant to kind of reflect the diversity of everything that we do. In our clinics, especially the one in Rushville, you'll find dental, behavioral health, social services. We are what we call a patient-centered home and a federally qualified health center. So we focus primarily on patients who have Medicaid, Medicare, or self-pay patients. We in Rushville do a lot of rural health, but we have patients from literally all over the Finger Lakes and even a few from Rochester. And we are all the primary care providers here in Rushville. So that's just a little bit about us, and I'll let Amy take it away.
Okay, can you hear me?
Mm-hmm.
Yes. All right, everybody. My name is Amy Arp. I'm one of the family nurse practitioners with Mosaic Health in Rushville. So to kind of start us off here, it's kind of, where are we now? It's been about 12 weeks of this COVID, and I just wanted to update you guys with what we're familiar with. As far as we know, COVID-19, for the most part, is mild to moderate symptoms in most people. It is a virus, and it affects everybody differently, but for the most part, it's like any other virus except for, in the older adults or people who have chronic health conditions, like anything understandably. It hits them harder. Their bodies are more immunocompromised and things like that. And so, this is a virus, but it's a very protect those vulnerable populations. So as far as symptoms, usually respiratory symptoms to keep in for, fever, shortness of breath, cough, things like that. Those are always the things to pay attention to. So if you feel like you're coming down with those symptoms, stay home. It's the best thing to do is to stay home and not expose that to other people, because you could be spreading the sickness. As we're going along too, we're finding out that basically any symptom can be a symptom of COVID-19, and that can happen with viruses. So just keep in mind, to keep your common sense about, if you're having things like intense fever, you can't eat or drink, abdominal pain, chest pain, just the basic health concerns, keep that in mind. It's always a good idea to still go to the ER, call your providers, this and that, because you don't want to forget, the basic emergencies still. So going on to what we can do and what we've been doing to protect and prevent ourselves and all those things, definitely hand washing. It's the one thing to do, 20 seconds of hand washing. Try not to touch your face, social distancing with 6 feet, covering your mouth when coughing, using tissues, cleaning surfaces. Those are all just basic things, basic hand hygiene and things like that to keep track of. The biggest thing too is to wear your mask, and because unfortunately we can't control what other people do, but we can control our own level of security and what we feel is comfortable. So if you want to wear your mask, and no one can tell you not to. You know what I mean? And basically getting to know your new as far as the new steps that are going as far as work. If you stay home, they're going to want you to stay home if you have a fever or symptoms, and communicate with HR to see what your new company policies are, because they might say, oh, don't return to work until XYZ or until you've been tested or whatnot. Just see what your company is doing as far as changes. And of course, this has been a very stressful time for everybody. So I think a lot of us have really gotten to know ourselves, to live in the moment, in the present, take advantage of technology and new resources. The New York State Department of Health actually has a lot of resources online for like mindfulness and meditation that are free, and basically, ways to distract yourself and keep busy, because this has been hard. It's been a huge adjustment for, family, everyone, children. It's really taken a toll on us, and I think everybody's eager to get back to the new normal, but it's a good idea to like reach out and, like Mosaic Health here, we have social workers on site. We have people who can help coordinate transportation services, food pantries, things that you just didn't think of during the pandemic, but there are still people in need that need these resources, and, we're still there for them. So if you ever need to know more information on that, you can reach out to us. And basically, how do we enjoy life safely from this point? So we're all about flattening that curve, because, we need to learn to adapt and move forward from this. And so businesses and people are slowly phasing back into society, and we've got some tips and tricks from Mallory and Sam on what they would suggest.
Hi, everyone. I'm Mallory Eberly, and I'm going to just mention about flattening the curve. So everyone had probably heard of this when COVID first came out, like how we have to flatten the curve. And basically what that meant was, less people getting sick all at once. So therefore, we have enough healthcare providers and beds in the hospital to treat patients. And going from there, it doesn't mean that there will be less people that get sick. The virus will go away if the curve is flattened. That's not the case. And then also, it doesn't mean that if we flatten the curve that the virus won't be as severe in those who are really high risk. So now we know that, Ontario County is now into phase 2. And basically that's all office-based jobs, real estate, services, and retail. The ones that are still closed are the malls, the in-service like dining areas and bars, the large gathering and event venues, gyms, exercise classes, but they do have those virtually now, which are great. Video and casino gaming facilities, movie theaters, and then public amusement. So basically, like a lot of people in the beginning were like, well, how do you get it? So coronavirus is a droplet infection, and basically it's when an infection person coughs and sneezes, talks, and then droplets from them get into the lungs of a different person, and that's how it's basically spread. However, by touching surfaces, that can happen, being out and about, touching something that's infected, then touching your nose, mouth, things like that are how it's transmitted. So basically now businesses are able to open back up, and what they're doing to stay safe can be found on the New York State Department of Health website, but basically 50% maximum occupancy. So not more than 50% of the people that you would normally have in at one time are there. And with that, continue social distancing, so those 6 feet apart, using 6 feet apart markers for patients or consumers to know like where is appropriate to stand that's actually 6 feet apart. Having their workstations cleaned often with the at least 60% alcohol-based hand sanitizer, disinfectant, and then also lots of signage inside and outside the facility, which Sam will talk more about. And then obviously for employees, screening. So again, like Amy said, staying home when you're sick, and then the screening checks when you go to work. So temperature checks, asking if they've had COVID symptoms, if they've been tested for COVID or have tested positive for COVID-19 in the past 14 days. So basically, the biggest thing is to still social distance. So knowing that those droplets can spread up to 6 feet, and also using your protective equipment, wearing masks, washing your hands. So a lot of people are like, well, I don't always know what 6 feet looks like, so what does that look like? And basically it's the width of a normal size sedan, think the length of a dining table, or the height of a door, or if you're out shopping, like 2 shopping cart distances. So try and be mindful of others and keep that distance. And then what is not social distancing? Visiting with friends and families while you're outside and on a windy day, because basically those droplets can carry. So be mindful and also take that into consideration when you're with those that you don't reside with, and wear a mask, wash your hands, use all those safety precautions. And then sitting in separate cars with windows down, if you're not 6 feet apart, it doesn't really matter. Like, that's still not social distancing. And also visiting each other through screen doors. So wear a mask if you're not 6 feet apart, because transmission can still happen through a screen door. And the CDC kind of recommends like doing the 5. So basically that's hands, so washing them often, coughing, sneezing, and to your elbow. So face, try not to touch it. And then keeping a safe distance between you and others, and then stay home if you're sick. So, and like Amy had said, you know, we can't really depend on others to take those safety precautions, but doing your own due diligence of wearing your mask, washing your hands, using hand sanitizer often is what's going to keep you safe, as well as some other safe. So there was, or is talk about a second wave. So basically with that going forward, we suspect that there might be a second wave. We don't know for sure, but it's basically been said that, you know, many medical professions have said in order to prevent a second wave or to make it less severe is early identification. So identifying those patients who do have COVID, and then also social distancing. So having those patients who have been tested positive for COVID, social distance even within their house with other family members, and then continue to contact tracing. So a little bit about contact tracing. It's basically like tracking a spider web of transmission. So having that patient who actually does not have to be identified to the other people while they're doing this tracing, so you can stay anonymous, and seeing like where they've been, what they've done, who they've come in contact with, who they've been within 6 feet for more than 15 minutes at a time. And then Sam's going to talk a little bit about when you're out and about, and actually like the length of COVID droplets. So.
Ladies, can I interject for just a moment? We've covered a lot of stuff, and wow, I feel more intelligent and also more humble just having heard all this. A couple of things I've heard in some other circles is on the employee screening frontier, because now that we're beginning to see people return to work, it sounds like there's some interesting resources for employers. Like, I know the CDC has what they call an online symptom checker, but if you go to cdc.gov, it literally walks you down a checklist of things to ask yourself, or perhaps the people that are working for you. And ideally, they should answer it before they come to work instead of after they've entered your building. And also, some people, and I'll confess, in our small office, we're using it ourselves, the Rock COVID app. I don't know, I'm not asking you to take a position on its efficacy or anything else, but I guess I'm pointing out for the audience, if folks aren't aware of it, that there are some convenient phone-based apps and other materials that if you just don't know how to approach this, that you can not have to be your own doctor. You can actually rely on these vetted materials that don't cost anything. They're publicly available. They can be loaded on your phones. And I know there are some workplaces that literally the green check mark on your phone is what you need to show to get in the door. And you know, we're seeing people I don't want to use the word streamline because that sounds like they're cheating or some way gaming the system, but that they're creating a culture of ease around doing the right thing. And I'm hearing a lot of great things. I didn't mean to interrupt. If anything else, I wanted to reflect that I'm hearing a lot of questions in other circles about what you're providing answers to. So thank you for what you've shared so far. And I'm going to get out of the way. Next.
Yeah, I think those are all great tools too, you know. So go ahead, Sam.
Can you hear me?
Yeah.
Yes, there we go. I don't know what happened
Together
there.
we can do anything.
Yes, okay. So the New York State Department of Health website actually has a lot of really good resources and checklists too. They're perhaps maybe not the easiest website to use, but they do actually have quite a few resources as well. One of the things we wanted to talk about was surface transmission as well, because I think there's a lot of confusion out there, and I think everybody knows wash your hands and wear masks, but the whole surface thing is really confusing to people. So there was a study that was given out into the public media that's talked quite a bit about. Which showed that the virus can stay on different surfaces for up to 72 hours. Which is true, and I'm not disputing that, but what kind of got lost in that messaging, though, from that same study showed that 99% of the virus was actually inactive after 24 hours. So there was still a small amount of viable virus up to 72 hours, but quite a bit of it was, dead after 24 hours, which should provide some reassurance. Also, the CDC has, put out there recently, there is no documented case of transmission from what we call a fomite or a surface. And it might be a little hard to prove, in fairness, but it is a theoretical possibility if somebody coughs and sneezes all over the ATM and then the next person goes up there and gets on the ATM and then scratches their face. It's a theoretical possibility, and there definitely are other viruses that are spread like that. So we kind of want to talk a little bit about, the proper way to take care of those surfaces. So the CDC recommends, doing as much contactless options as possible. So doing as much online or over the phone as you can, or curbside pickup, but then frequently washing your hands, and then also cleaning commonly used surfaces. So they put ATMs, gas pumps, the shopping cart handles, desks, phones, electronics, keyboards, anything that's shared should be wiped down frequently. There are multiple things out there that can be used as a disinfectant. The CDC says household cleaners and EPA registered disinfectants are usually fine. Some common kind of things to consider: one is if you have a dirty surface, like an obviously dirty surface, clean it with soap and water first, then disinfect it. If you're using a bleach solution or an alcohol solution, give it like a minute. Let it kind of sit there and be in contact with the surface before wiping it down and letting it dry. Using disposable gloves. So you wipe down everything, you take the gloves off, you throw them away. If you do use reusable gloves, make sure you're only using those for disinfectant and that you're not using them during other activities throughout the day as well. For most soft surfaces, again, you can use the EPA registered disinfectants and household cleaners, and using, if you have laundry, like the warmest water that the material can handle or that's recommended by the manufacturer. There's a lot of really good resources out there that Ethan mentioned. The CDC has them, New York State Department of Health has them. What I think is maybe more important that is the communication about what your business is doing to protect people. So we, as frontline workers, get this quite a bit, which is we have patients who are scared to come into the office. We have patients who will call with chest pain who don't want to go to the emergency room. And obviously you still need to go to the grocery store. You still need to go to the emergency room if you have chest pain and things like that. There was an article or an editorial really published in the Journal of American Medical Association that really talked about this importance of communication. And it's something we found in what we do in our office is really important. People are scared and unsure. They're also inundated with information, and not all of it good information either. So the clearer your communication is about what you're doing to protect your customers, I think the more secure they will feel. So to that end, making sure your employees are wearing appropriate facial coverings and wearing them correctly. I can't tell you how many times I go into Walmart and people aren't covering their nose, and it sits right here and it drives me up a wall. it doesn't work if it's not covering the nose and the mouth. That's definitely key. Another tip that actually came from the JAMA article that I completely agree with is make a show of cleaning. So for instance, when I'm at Wegmans, I notice which cashiers don't clean the beltway in between patients, right? I noticed that right away. So, tell your employees, make a show out of it. It might seem stupid. And, I think there's maybe in previous times, especially in like the restaurant industry, we would kind of hide some of that stuff, or, you didn't want to interfere or intrude on the customer's time. But I think in this day and age is rethinking that. And, we actually do want to see you cleaning and really taking those extra steps. It'll make your customers feel more comfortable. It makes our patients feel more comfortable. Go ahead.
I was going to say, we as the Chamber of Commerce find ourselves at the intersection really right there, because a lot of what we do is we try to the best of our ability to engage travelers, tourists, and locals to get out and enjoy things and, frankly, drive the economy. But at the same time, folks won't do it if there's an absence of confidence.
Right.
And, they say it takes 2 weeks to establish a habit. It's been a lot more than 2 weeks, and a lot of us are not going to normal people, places, things, and situations where we would exchange currency and where we would be driving this machine called an economy. So part of our recovery will be keeping that curve flat, but part of our corresponding economy, there's certainly the social and health economy, the social and health recovery, but there's also a concurrent economic recovery, and both of them are important to the end game, so to speak. So I completely agree, and I'm going to leave it at inspiring consumer confidence by being seen, being a good, careful housekeeper during these times. I think it's going to make us more customers and longer friends than ordinary business ever would have.
Right. I think protecting the social and health, I think protecting yourself socially and health-wise does not have to be anti-economic. That I think we have that kind of dialogue that these two things have to oppose. And I think that there was a time frame where maybe those two things had to oppose to keep us from having the dramatic, events that happened in Italy. But I think that we can go forward now and we can protect ourselves. And by making a show of protecting ourselves and still consumer confidence, because consumers do want to feel like they are taken care of. For us, for our patients, one of the big things, and it was kind of stupid, you would think we would know better, we are a medical, but it took us a minute, like just saying, how are you doing? It was the common sense things that, maybe because of the panic we've forgotten, but those common sense things made a big difference. We reached out to our patients who, had different diagnoses that made them high risk when this all started. We called them, we told them, okay, this is what we want you to do in terms of social distancing and staying home. And oh, by the way, how are you doing? Do you have everything you need? Our patients are low income and were frontline workers. They did work in restaurants and gas stations and things like that. And a lot of them did lose their jobs, and that was very difficult. They lost their health insurance and they lost food, but we were there asking them, how can we help? And they really appreciated that. And I know that they made quite a few comments about how they were glad that we reached out to them and that they weren't getting that same support from maybe their other providers. So that reaching out and acting like we're all in the community and we're all in this together, I think makes a big difference. And the little things help. I think Mallory and Amy both mentioned signage before. One of the things we talk about in medicine is health literacy, which is basically we can spew a lot of technical terms at you and you might not know what we're talking about. And the reality is in America, you should assume people have like a 5th grade reading level or less. And you should, when you make signage though, you should kind of keep that in mind. I've gone up to stores that have signs that are like, yeah, I got to sit right there and like read it. And I'm standing there for like 5 minutes trying to figure out what they're saying. There's that old axiom, KISS, keep it simple. You guys know what the other word is. And so keep it simple, keep it bold, and big font. Don't forget, the elderly can't see that well, so it might even be that they can't, not that they can't read, but they might not be able to see that well. If you have tiny little font, they might not know what's going on in your store. So keep it big font, keep it bold, and keep it simple instructions. And if you have to do multiple signs to get your point across, that's better than trying to cram everything in on one sign as well. Decluttering, make it easy to social distance. I know it's probably not fun for a business to take product away and make aisles wider, or take tables away, or take chairs away, but it does make it easier for people to social distance. I think we've all been in Wegmans and wish those aisles were bigger. And, we wish that it would be easier to social distance if we had more space in Wegmans. And that's just something to keep in mind. Like in our waiting room, we cut all of our chairs in half. We took away the magazines and the toys that unfortunately, were provided entertainment while you were waiting for your appointment. But our goal is to, reduce transmission in those objects, but then also our goal is to get you back to the room faster too. So decluttering, really clear signs, make a show of cleaning. If you project that you're trying to protect your customers will feel valued, and then they will want to come back. That's at least our experience in primary care. From a patient standpoint, patients who feel valued come back. And so that's what we try to do. That's part of our reaching out. What we're doing is we're integrating telehealth into what we do. So, right now, as you can see, I'm home and Mallory and Amy are in the office. And we rotate that. So I do televisits at home. They do in office. It limits the amount of contact and exposure people have with other people. Especially because, if you're coming to a doctor's office, there's a good chance you're a little bit more high risk than other people. So we really work hard to protect them. We try to bring people straight back, declutter the waiting room. We're checking temps and symptoms. Everyone's wearing masks. We have tons of signs out. And, we're just trying to do what we can to still serve our community and accept new patients, but keep everybody safe. And if anybody asks, we have separate rooms and separate entrances that we're using for any potential COVID patient. In fact, we just say anybody with any what we call upper respiratory symptoms, so coughing, sneezing, whatever, you're just automatically going in a different entrance and different rooms so that we're not, having that cross-contamination. So it's a lot. I know there's a lot of different information out there. The CDC, the New York State Department of Health really do have good information. And just don't be afraid to call your own provider and ask questions either. That's what we're here for. We've taken quite a few calls on the anxious. I don't know what I have. Is it allergies? Is it the flu? Is it strep throat? Is it COVID? And we're more than willing to walk people through that. I'm sure your own doctors are as well too. So with that, I guess if there's any questions or concerns or.
I'm taken by it. Just listening to this. I think of how much so many of our lives have changed since March 13th, and that it's easy, I think, in times of trouble. I hearken back to 20 years ago when we went through 9/11. First responders, health providers, folks in charge, and their best friends, their dogs, are often expected to, to provide care almost unconditionally. It's your job. You signed on for that. Forgive me, that's not me.
No.
I'm just kind of echoing that.
Yes.
But what I'm reminded of in your circumstances, and we've had similar interesting conversations with other leaders in the community, that we are so fortunate to have the talent we do in organizations like yours, that in just a matter of days you can completely pivot your business model. Telehealth has been a conversation in some rooms for 15 years.
Mm-hmm.
And suddenly, everybody that I can think of who's been to the doctor in the last month and a half has gone there on their phone.
Yep.
And
It's true.
We're teachable. It's fascinating to watch folks like you, in small communities, larger communities, wherever, that that we're finding ways to make the people that are important to us understand that they're important to us, and to make them feel safe in a time when there's a lot of media out there that would make anybody feel unsafe. And I know that part of the population you work with has some mental health overlay, and that it's particularly difficult in a time when we're asking people to be away from people, that many people connecting with others is medicine. So thank you for the outreach that you have done for the people that you serve, for the time that you've dedicated to serving the people on this call today. There's a lot of people hearing things that they may not have heard before, including inspiration. That just literally, that folks in situations like yours are being mindful of segregating, if you will, people that exhibit symptoms from people who don't, and finding alternative channels for care and treatment and communication, instead of just saying, we can't do that. Or perhaps even worse, in small, close communities, advising out of the community. I'm imagining an organization with the history that yours has, you have people that wouldn't go anywhere else if they had to, because of who you are and what you give to them. So I'm mindful of so much of that, being from the Finger Lakes originally, and I'm familiar with some of the smaller communities around, and many of the not-for-profit and community service providers who quietly go about changing the lives of people every day, whether they be like yourselves or folks that deal more specifically with developmental disabilities or recovery or whatever, that those needs didn't stop because the governor said you're not supposed to go out. Well, people's symptoms don't understand that. That's going to continue.
And I think, you know, also to that point, though, I think this has also taught us quite a bit about what really is essential, and broaden our view of what a frontline worker is. And you need somebody to check out your groceries, and you need somebody to be at the bank and at the gas station. And, you know, we need to value that more too in our community as well. And not just, you know, I mean, I love being a nurse, we all do, but, you know, we need to value all of our parts as a community, and I think as we do that, we will do better. Yep.
Absolutely.
Well, and I also, I'm going to give up the mic here in a minute, I promise. I'm correlating this pretty directly to our friends in retail and hospitality, because I realize that in healthcare, you're serving a consumer group that literally, while the alternatives may be unattractive, consumers in healthcare can stop going to the doctor. They can decide not to abide by their treatment regimen or not take their medications because it's too difficult to do it right. You know what I mean? That either I can't get to the doctor, or it's scary out there, or whatever. And I really see a pretty direct correlation to other things that I'm never really going to advocate that healthcare is optional. But as a guy who's skipped a few dentist appointments in his life, you can always delay. You can always come up with an excuse. Yes. You can always say, well, you know, I feel just as good when I'm not on my medication, which is usually not the truth. And I think at the same time, there are people that can say, well, you know, I'm not going to eat out for a while, but it won't make them not be a fan of a restaurant, you know. That in the short term, many of us are dealing with an alternate reality. But I think our call to action as partners in a regional, like, social economy health system, I mean, I don't think any of us can pull apart healthcare from really anything else in our lives. We can't say, oh, the economy and healthcare are separate. We can't say that quality of life and a solid downtown are separate. We can't say a good education system has nothing to do with healthcare, or, you know, poverty. So with all those things going on, it's so, when I said earlier I was humbled, to listen to how you are responding to people of different means, people with different transportation issues, people with different degrees, most likely, of connectedness you may well have some people for whom telehealth is not an option because they can't get on the internet.
Mhm.
These are real considerations. And it's interesting to watch that on one hand, we're moving leaps and bounds. Telemedicine was probably just a cool idea until about 2 months ago. And now
It's a necessity.
it may become a permanent subculture that we didn't expect. But now we're really discovering that those conversations we've had for 5 or 10 years around, you know what, a lot of people in the Finger Lakes still don't have internet. That's becoming more important than it's ever been before. And not to be fresh or take things lightly, I think we're at a very exciting time, because I'm not welcoming the pandemic. Don't mistake me. I'm realizing that I'm getting in touch with humanity, and how the people that we know, that when they're challenged, they rally to it. They figure it out. And if they don't know how to do it, they find people around them that may have to stand 6 feet from them, and bring them together, and they figure it out. They don't give up. They don't step back and say, it's not my problem. Many of us, when we work at home, probably report working harder because they don't hear the 5 o'clock whistle. What do you mean it's time for dinner? Wow, I'm sure there are questions from the audience. I haven't formally asked for them, but let's look and see what's cooking in the hopper here. I think my co-presenters can also see what's in the hopper. There's a question about Rock COVID app. Does somebody on the panel want to talk to? It's the one that creates the green check mark? Yes. That's my understanding, but I'm not a healthcare professional, and I don't want to play one on TV. So
do you guys have familiarity? I haven't used the app yet, because
I haven't used it personally.
We're all like, I haven't used it personally. I have another app that I use, which is How We Feel, which is more of a national symptom tracker. But I can definitely look into it more, and direct resources, send it to you, Ethan, if you want to have a way of distributing that information.
Yeah, and I'm sure there's no such thing as the one, but How We Feel, if I put that in a search box in like an app store, would I find it?
Yep. Yeah, it's I believe, I'm trying to remember the exact organizations that it was set up with. But How We Feel is the name of the app, and it's just another way of tracking symptoms and community spread and things like that. So,
and using common language. That instead of saying, oh, I feel okay, well, what does that really mean? Well,
right.
In our office, we go down the same list of things every day because the app asks you those things, and you have to say, I don't have any of those symptoms, and then it says, okay, good. Yes.
I think people are learning to pay really attention to their bodies too. And, I've heard that from my patients. I've heard that from friends and family. Hey, is this my typical allergy season, or am I sick? And those kind of things it does.
Something else that we talked about a little earlier that, Amy, I think you were the one that brought it up. I don't think any of us can ever hear enough about relaxation and managing stress, because I don't think any of us goes a day and doesn't hear something in the media or something over lunch or read something online about what stress literally does to the body, the chemical impact it has on us. Do you have maybe any favorite things you like to share with your patients about ways to maybe center oneself or ameliorate some stress in the moment that you can do without, maybe without an app? I know that, there's some pretty cool stuff out there, especially when it comes to online and that, but again, there's a means test there. And I'm looking maybe for things that, for people that spend so much of their day plugged in.
Yeah.
Do you have any particular exercise or something one might maybe repeat to themselves? And I'm going to stop there because I don't want to answer the question.
I don't have anything in particular that I recommend, but I would just say to let people, get to know themselves and spend time with themselves and see what works for them. Like actually being in the silence, learning to be content with it, to be there with yourself, meditate, look around, smell the flowers, appreciate the sunshine, all those things outside that we normally don't do because we're so engrossed in our phones and with distractions and social media. And it's just to get back to the basics of life. And, this is really what life is about. And, I appreciate being here alive today. And, I've got family and I can't see them now, but I will in a few weeks, and that's okay. We can always call them by phone. That's what people have done for, many decades. We don't have to text each other. We can call each other and things like that. But just getting back to the basics and learning to really know yourself. And it takes a lot of time and, an effort to do so, but you can really learn how to be content within if you do that.
Well, you brought up a key word I don't think we've necessarily heard before in the call, and that's family. I don't have kids of my own, but I'm dialed into a lot of other folks' universes that I am taken by the fact that even coming up when I was in school, between sports and scouts and band and all that many families 20, 30 years ago had 2 meals together every week. And then, you add the overlay of daycare became a more normal set of growing up, and, dual incomes have become more the norm and all of that going on. And then suddenly the whole family unit's back in the house. Maybe do any of you have any tips and tricks on, how to meet that teenager you never thought lived in your house?
I mean, I'll admit
Mallory,
that
I think we should let her take that one. She's the one with the kids.
There you go.
They're not teenagers.
Yeah.
But other than that, I mean, I really enjoy them. So for the most part, it's like letting them, be able to go outside, which it's been really cold up until recently, but you know what I mean? Like spending time with them, doing things as a family, of course, just within our family. I know that it is hard for people whose families do live far away, whose parents aren't able to see their grandchildren and stuff like that. But as far as like decompressing, like at the end of the day for myself, like I always take at least, a good 30 minutes, and I like to read. So I like read a book, which totally gets your mind in a different space, which is what I like to do. It also helps me relax. And then I also like to get out and get exercise. I think that, as far as stress goes, even 15 minutes, like a leisure walk, get out, fresh air, bundle up if it's a little chilly, is for me really helpful personally. So.
And there's been a lot of studies about getting out in nature and just being around green stuff actually is a major relaxation. And you talk about means, and we are very fortunate to live in the Finger Lakes region. So there are tons of parks and trails, and even sometimes just walking out in your backyard, can be really a great thing to do with you and your family. There's also been tricks of like setting up, one of our counselors often talks about setting a delineation at the end of the day. So a lot of us are working from home, and that can bleed into, now we're working at even later hours because we can't stop. So she often recommends like do something to mark the end of your day, that's your designation. So even if it's just as simple as walking down to the mailbox, get the mail and walk back, this is my signal that that's the end of the day. And I'm going to focus on the family things, and things like that.
Nice. Presumably a similar signal for this is the end of the school day. If you're managing that at home, this is what recess looks like, and so on. We have a question in the audience that I think is a very good one, because there are a few of us left that don't use credit cards that often. A question about cleaning currency. Any recommendations on that, even in the most general sense? Do you hear anything professionally? Do you do anything personally that you might advise?
When I was doing some research for this, I didn't see anything specifically on cleaning money. I'm sure that that's a very difficult thing. I think probably the best thing with money just is to clean your own hands. I think that's the most protection that you can do. If you can't clean everything around you, or sanitize everything, and especially money. I couldn't imagine stopping to clean every dollar bill I got at Abbott's or something like that. So I think the big thing is really, if you clean your own hands, remember this is about protecting the transmission to yourself, right? The dollar bill isn't going to give you you COVID-19 unless you touch something on the dollar bill and then touch your mouth and on all that without cleaning. So clean your hands frequently, and wearing a face mask also keeps you from, when you forget and touch your face, at least you're touching the mask and not your actual face. So I think I would focus more on that. But if I read or find anything differently about clean money, I will definitely send it to you guys to promote as well.
Well, thank you. And to the audience, depending on how much money you handed over the counter in the first place, it's always good form to just leave the balance as a tip.
Yeah.
There's one way not to worry about how to touch it.
Yes.
But yeah, I think it's a worthwhile concern, because when we think of all of the things in our universe we're expected to sanitize now, there's certain things that we lose custody of, or that we're still, some circumstances still require you to hand over a credit card, or, you know, we talked about gas stations and things like that that have really rallied. You know, they provide sanitizer on location and things like that. But, and I would agree completely that most of, at least for me, I had no idea how often I touched my face until I put a mask on. And then I'm like, oh, I just touched my mask.
Yeah.
You know, works like a charm.
Yep.
But, yes. I don't see any other questions from the group. We certainly have a little bit more time if we want to do that. And on this panel, anything that we haven't discussed, anything you want to introduce, any way you might want to maybe offer a homework assignment to your audience on how to manage the balance of their week a little differently, to maybe reduce their stress or their likelihood to, you know, get something communicable of any kind from anybody else.
Well, it's Rochester, or upstate New York, I should say, and it's sunny, so get outside. That's my homework. Get your vitamin D levels. And I think that the most important thing, you know, in terms of anybody who is, you know, worried about getting coronavirus himself, I'm a big believer, if you take care of your body takes care of you. So eat healthy, exercise, get your 8 hours of sleep, you know, throw on a multivitamin and a vitamin D supplement. It's certainly not going to hurt anything. And just remember, you know, there's a lot of, I'm sure, political motivation about wearing masks with some people, but it is as equally about protecting yourself as it is about protecting other people. And you don't know who that other person has at home, who's, you know, standing right next to you. And they could have you know, an elderly grandparent living with them, or a sick child. So, you know, just remember, it's about caring for your community as much as it is about caring for yourself.
Thanks, Sam. Anybody? Mallory, Amy?
I would just say, you know, in general, you know, we're all gonna make it through this. It's a time where we have to learn to adapt and grow and come together and make changes, and that's, you know, that's a good thing. Like you were saying earlier, Ethan, like it allows for a lot of growth and learning, and we'll learn from this, and we'll always remember, you know, the pandemic of COVID-19 decades from now.
Yeah.
Yeah, and like Sam had said earlier, you know, communication is key. So keeping those lines open for employers and employees, and, you know, taking care of each other, basically. We are a community, and we are all in this together. You know, every single one of us is dealing with COVID-19. There's nobody who isn't, just on different levels. So definitely keep that in mind. And like Sam had said, wear your mask, wash your hands, continue social distancing, and, you know, being in phase 2, hopefully we'll get to phase 3 and, you know, continue doing these things and having that change, but have it be a positive change. So.
Very good. Well, there being no other questions in the queue, I just want to take one more opportunity to thank you for the time that you've set aside for this. For those who are still listening, if you've heard things that you want to share with others, this session is being recorded, and within one business day, we'll have it available online for people to share. And I'm going to take some of your advice, and this afternoon, when my day is done, I'm going to go outside, because we are fortunate to live in one of the most beautiful areas in the country. And perhaps when I'm not sure I'll recognize you with masks on, but maybe someday we'll have the chance to connect over lunch. So again, thank you very much. Best wishes, and keep up the good work. You inspire us. Bye now.
Thanks.